So I will be performing Sperling's test. This is done to help identify a cervical radiculopathy. So what you do is you have the patient sitting on a chair, sitting up straight, and you laterally flex the head and apply pressure down, and then laterally flex to the other side and apply the same pressure down. After applying pressure, you're going to ask the patient if they have any recreation of symptoms. That would be numbness and tingling down the arm. Next, I will be performing the compression test. This is done to help identify cervical nerve root impingement. So you have the patient sitting in a chair, sitting up straight, and making sure their head's in line with their body. Next, you tell them that you're going to be applying a compression force. You're going to be pushing on their head. So push on their head, and a positive sign would be recreation of symptoms, which would be numbness and tingling down either extremity.
I will be performing the distraction test for a cervical nerve root impingement. For this test, you have the patient lying on their back. You grab their neck and their head. You have them scoot back towards you a little bit, and you just pull lightly, and this should relieve their symptoms. I will be performing the BEST test. This is commonly used during a concussion evaluation. For this test, you have the patient stand, both legs with eyes open and then eyes closed, each for 20 seconds. Then you have them stand on one leg, on the non-dominant leg, for 20 seconds, eyes closed and eyes open. And then tandem stance with the non-dominant leg behind, for 20 seconds, eyes closed and eyes open. You also do all of these on an Airex pad if available. The BEST test is scored each time that the patient makes a movement out of balance. So if the patient is standing like this and they wiggle over, that is 1 point. If they step down and wiggle, that's also 1 point. Each point counts after the patient gets reset.
Right, everything's gonna be nice and relaxed.
I'll be instructing the patient how to do active neck range of motion. So sit up nice and straight from me. Have your chin touch your chest.
You can be more aggressive.
Good. Now come back up.
Look at the sky. Right now, while still healing, I want you to keep the length of the muscle.
And look at the
I
other.
also don't want you to pull too hard.
Now,
while these
bring
bonds
this
are trying to
shoulder.
reform. Okay? Foam rolling is fine. No matter how sore it is, foam rolling is okay.
I'll be taking the patient through passive cervical range of motion. Just relax. Flexion. Extension. Lateral flexion. Lateral flexion. Rotation. And rotation. Now I'll be accessing resistive range of motion. So bring your ear to your shoulder. Come on. Good job. Come back. Now bring to the other shoulder. Now try to rotate this way. Good. And the other way. Good. Now let's slide off the table. Bring your head down. And bring your chin to your chest. Good. And now come back down. Very good. Matt. I will be performing a cranial nerve assessment. These assessments are done if a head injury is suspected. And you read that sign on the wall. Skeletal system. Thank you. Can you close your eyes and cover one nostril? Can you smell this? Good. Now do the other. Can you smell this? Yes. Good. Can you hear this? Good. Can you hear this? Good. Now open your eyes. Follow my finger. 4, 3, 2, 1, stop. Good. Can you smile? Can you frown? Can you stick out your tongue? Can you talk? Yes. Mix. Now, can you bring your head to the shoulder? Good. Now can you stand up? And can you balance on one foot? Good. Yes. Olfactory, smell, optic, sight Ocular motor is eyeball movement and pupil reaction. Trigeminal is facial expressions and facial sensations. Trochlear is eyeball movement. Facial is tears, saliva, and facial expressions. Vestibulocochlear is auditory. Glossopharyngeal is swallowing, saliva, and taste. Vagus is control of the PNS and smooth GI contraction of muscles. Accessory is head movement and shoulder movement, and hypoglossal is tongue movement and speech and swallowing. I'll be assessing upper extremity dermatomes. So I have your arm right here. C4, C5, C6, C7, C8, T1.
So bad.
You're assessing these for any altered sensations, numbness, tingling, anything of that matter. I'll be assessing upper extremity myotomes. Can you bring your ear to your shoulder? Don't let me. Good. Now that's C4, C5, arms out. Good. C6, from arm in. Good. And wrist extension. Good. Now push down, C7. Good. And wrist flexion. Good. C8 is arm deviation, hold there. Good. And thumb extension. Good. T1. Spread your fingers. You're gonna push, don't let me. Good. Squeeze my fingers. Good. And curl in. Good. You assess myotomes to determine the integrity of the muscle contraction. A positive finding would be no muscle contraction.